Welcome to all of you on World Hearing Day. So I'll be presenting on topic noise-induced hearing loss. This is the most common cause of hearing loss worldwide. So talking about the prevalence of noise-induced hearing loss. 12% or more of the global population is at risk for hearing loss from noise. That amounts to almost 600 million people worldwide. And if we see the statistics of WHO, it is seen that 1/3 of all cases of hearing loss can be attributed to noise exposure. So जो 3 लोग जिनको hearing loss है, उनमें से एक को noise के कारण hearing loss हो सकता है. Now talking about from where have we derived this word noise. It is from the Latin word nausea, which is a meaning of impulsive, unwanted, unpleasant nature. It interferes with the human communication, comfort and a feeling of well-being. Also, if we, how is the noise measured? It's very important to understand that it is measured in decibel, which is a logarithmic scale. So this means that a sound of 20 decibel is 10 times more intense than a sound of 10 decibel. So जो 20 decibel की noise है, compared to 10 decibel, it is not double, it is 10 times. Now, who has been in this situation? I think most of the people who are having in this city life. So in this situation हमारे जो ट्रैफिक ऑफिसर्स हैं जो हमारे साथ थे अभी वो हमारी काफ़ी हेल्प करते हैं, लेकिन इस सिचुएशन में the noise exposure that we have is almost 70 to 95 decibel. But if we compare, if we go to the Himalayas and we enjoy the birds and the scenery, it completely changes. Our decibel levels comes down to 30 to 35 decibels, which is almost 1,000 times less. Now when I'm talking to you, this is about 40 to 55 decibel, and when we whisper it is 30 decibel. लेकिन हमारी surrounding में there are lot of common noises that can be considered loud and can be the cause of noise induced hearing loss. जैसे हमारी washing machine घर में, that can be a 70 decibel. As told you earlier, 80 decibel in the traffic noise inside a car. A leaf blower can give a sound intensity of 90 decibel. A sporting event, concerts, they can go up to 100 to 110 decibel. And a siren, which we hear commonly in the hospitals, that can go up to 120 decibel. It is important to understand that the limit that has been given through all the studies is 85 decibel. तो आप किसी भी environment में हैं जहाँ पे 85 decibel से ऊपर आपकी आवाज है, so you need to be careful, you need to move out of this area, or you have to keep the duration short, because at 90 decibel 2 hours is enough to get you noise induced hearing loss. At 110 and 120 even few minutes can cause hearing loss. These are some permissible noise levels in India that has been described by the government. What is important for us is mainly the residential areas. It is important to keep the limit at 55 decibel during the daytime and 45 decibel during the night time. As a resident of any area, it is our responsibility that we keep these noises to the minimum. In the commercial areas, it is slightly more like the mall areas. And in the industry, the permissible limit is 75 decibel and the 70 decibel at night. हम usually जब हम पहले सोचते थे hearing loss, noise induced, हम ये सोचते थे कि it happens only at the workplaces, places where there is an occupational hazard, like the textile, printing, sawmills and mining industry. Though I told you that there's a lot of ambient noise, but India is a country where we have lot of workers and lot of industry, so this problem is still prevalent all throughout the India. And especially talking about the traffic policemen, we do have a high range in the road traffic, which is 60 to 102 decibel. इससे भी traffic policemen who are exposed for long time can have hearing losses. This is to tell you how loud is too loud. So if we are exposed at 85 decibel, our maximum duration that we can have is 16 hours. And even increasing 5 decibel, the duration comes down to half. So when we reach 110 decibel, we cannot have more than half hour of exposure. ये एक important question है that how noise causes permanent hearing damage. So the basic unit of hearing is in our inner ear. We have outer ear and inner ear cells. The hair cells are the ones that get damaged when the sound vibrates and hits the inner ear. So these damaged cells, once they are damaged like this, they can never recover. Then we can only amplify with the hearing aid. Now talking about the stages of the noise-induced hearing loss, initially when we are hit with an acoustic trauma, we have a noise-induced hearing loss which is not picked up by any machines. It is just changes in the synapses that happens which can recover. The second stage is a temporary threshold shift, which is the most important because isme the patient will have a hearing loss, he will complain of hearing loss, but it might recover in few days, it might recover in few weeks. So in this phase, if he has repeated acoustic trauma, it might lead to permanent threshold shift. That means the hearing loss will never come to the baseline and he has to use some hearing aids or aided devices. I want to ask this question. Have you ever experienced ringing sounds in your ears or head after being somewhere noisy? I think a lot of people have. So what exactly happens? The patients describe that as if 1,000 honeybees are going in my head, or they say as if a train is running in my head. But this symptom, tinnitus, is a very, very important indicator. It is sometimes noticed even before the hearing loss develops. So tinnitus can be a sign of a temporary threshold shift, and it might tell us that yes, you have been exposed to a sound, have damaged the outer hair cells, and you have to take a break. Also, the patients who are exposed to noise-induced hearing loss, they have initially difficulty with the high-pitched sounds. They have difficulty in conversation, especially in a group or when there is a background noise. They have an inability to hear consonants. So, cell, shell, fell. All these three words will actually sound similar and be difficult for them to talk to other people. Also, they tell us that they have to raise the volume of TV to hear. हम हमेशा बात करते हैं कि noise induced hearing loss is affecting our hearing, but there are a lot of other aspects to it. The non-auditory problems. It can lead to high blood pressure, heart rate, stress and anxiety, fatigue, headaches, anger issues, irritability, communication difficulties, and even falls in the elderly. So when you are visiting an ENT specialist, mainly when you have the starting of the symptoms, the main key, the crux of this whole thing is कि जब भी आपको लगे कि मेरे को slightly hearing loss है या मैं noisy environment में गया था, you should visit your ENT specialist and get a hearing test done. Because recently all the studies have said that intratympanic and systemic steroids given in the early phase of acoustic trauma can help in recovering the hearing loss. And obviously, if it's a permanent hearing loss, we have to go for hearing aids and amplification. Also, there are particular set of people who are more susceptible to noise-induced hearing loss. They are the patients who have diabetes, hypertension, heart disease, of course, the elderly and children, and the chronic kidney disease. Just in brief, I'm going to tell you how to go about it. Recently, a lot of apps are there in the mobile phone which can identify the decibel level in your environment. So you can use those apps to know how much noise is in the surroundings. Prevention, I'm going to talk in the next slide. And obviously, early diagnosis is the key. You have to visit your ENT and audiologist to get your hearing test and confirm your hearing loss. The main three things are protective for the noise-induced hearing loss. The first is the earplugs, which is the most commonly used thing, which can be easily bought even online. So you just have to pull your ear and insert the earplugs. You can even get a customized earplugs for patients who have undergone ear surgery or have small canals. They are better fitted. The next is the ear caps. And the third one, which is used in industries like airline industries, are the earmuffs, which give the best protection. I just want to say in brief that hearing loss is preventable, but once your hearing is gone, it won't come back. So you have to take good care of it. So wear ear protection, turn down the volume, and walk away from the noise. So this is my son enjoying his very first music, light music, and you can see how much joy he gets out of it. Thank you so much.